Welcome back to the Holistically Well podcast. Today, we're answering a question that so many women don't even know they should be asking. When should I see a pelvic floor physical therapist? And what does a pelvic floor physical therapist even do? We're diving into all of this because, spoiler alert, it's not just for postpartum moms or people recovering from birth injuries. If you've ever dealt with leaking pee, urinary urgency, painful sex, constipation, low back, or hip pain that just won't quit, then this episode is for you. So, the pelvic floor truly encompasses so many parts of our body that many women do not even realize it is a part of. And so, today's conversation, I think, will be really eye opening across the board. Now, what is a pelvic floor PT and what do we actually do? And this is another question that I was recently asked by somebody in my community. So let's start with the basics. A pelvic floor physical therapist is a licensed doctor of physical therapy who's undergone advanced specialized training to assess and treat the muscles, fascia, nerves, and coordination of the pelvic floor. Now, this is a group of muscles at the base of your pelvis that supports your bladder, uterus, rectum, and spine. So, our bladder, that's of course where we hold our urine, and we are urinating every single day. Our uterus, which is where we will grow and develop new life when pregnant. And it is also where we have that monthly shedding of the inner lining once we meet that menstrual cycle age. The rectum is where we have our bowel movements, right? Now, the bowel movements should be occurring daily, at least once a day, if not twice. And that is removing waste from our body. If you are not having regular bowel movements, a pelvic floor PT can help. And then the spine. So when we look at the spine, it really is the anchor in the back portion of our pelvis. Now, those pelvic floor muscles attach directly to your tailbone, your SI joint, and that is the base that your spine sits on. So for individuals with chronic low back pain, I am definitely looking at the pelvic floor. If we loop the pelvic floor around to its front attachments, you have the pubic symphysis. Now, this is the meeting point in the front of your pelvic bones. You may hear of women have pubic symphysis dysfunction or a lot of pain in that front portion of their pelvis during pregnancy or postpartum. And the pelvic floor certainly can play a role in that because it attaches on the inner side of that front pelvic rim. Now, if we take it out to the side, our pelvis also houses our hip joint. So it has this concave, this half circle, half moon shape that is called your acetabulum. And that is what your thigh bone, your femur, comes into to form your hip joint. And so the pelvic floor is this group of muscles, this hammock of muscles with three layers that is at the base of all of that. And so often the pelvic floor is just this arbitrary thing. And even in PT school, we had one course that talked about the pelvic floor. And when I say course, I should say lecture. We had one 60-minute lecture about the pelvic floor. And so that is why it is not something that every single PT looks at because they're certainly not trained to. I had to go through additional training to be able to evaluate and treat and support that pelvic floor for my patients. So, what sets a pelvic floor physical therapist apart from a general orthopedic or sports medicine physical therapist is not just that we deal with the pelvis or that we evaluate and treat the pelvic floor. It's that we look at your entire body and how it interacts with the pelvic floor. From how you breathe to how your core functions to how your hips and spine move. So, we talked about the backside of the pelvis where that spine meets. We talked about the sides of the pelvis where those hips come in. We talked about the very front where that pubic symphysis is, but the top is where that core comes in. So, for any women dealing with a diastasis recti or who have trouble just accessing their core or feel like they just can't gain good core strength or coordination, The pelvic floor is a huge component of that. The pelvic floor and your deep core contract in unison when they get their maximal contraction. And so, if the pelvic floor is just not addressed at all, you are not going to be able to get full core strength. So, it's involved in a lot more than what we initially realize. So, pelvic floor physical therapists are trained to treat incontinence. So, this is both urine and stool. So, if you are leaking urine or bowel movements, stool from the rectum, both of those we are trained to treat. Pelvic organ prolapse, which is when those internal reproductive organs or that bladder start to prolapse through or kind of herniate through the tissues of the pelvic floor. So we think of an inguinal hernia, which is in the front, kind of between the hip and the front portion of that pelvic floor. And we think of people herniating there. We can herniate in the pelvic floor too, and that is called prolapse. And what that feels like is a pressure. Sometimes you can actually feel your internal organs prolapsing through or moving through those holes or weak points in the pelvic floor. Pelvic floor PTs are also trained to treat pain with sex. And I will take this a step further and say even pain with inserting a tampon or pain with internal examination, such as when you're going in for that pap smear. If you have significant pain with any kind of insertion in that vaginal area, we can help you learn to relax those layers of muscles so that a common monthly thing, such as inserting a tampon or a menstrual cup, things like that are not painful for you, and so that you can enjoy intimacy with your spouse. Tailbone pain is also something we see a lot of, core weakness or diastasis recti, as I touched on earlier, and then of course hip, low back, or SI joint pain that has a pelvic floor component. Spoiler alert, most of these orthopedic issues that are around that pelvis area have a pelvic floor component that is often overlooked by a traditional PT. And then, of course, bowel issues such as constipation or this quick urge that you need to go. So, most importantly, though, we help women reclaim that connection, strength, and confidence in their body without just being told to do more Kegels. In fact, in my years of combining orthopedic and pelvic floor PT, I have not once prescribed Kegels. Not once, okay? So if you are going to a provider and they tell you to do Kegels to help heal your pelvic floor discomfort, whatever that may be, go seek out other help. Kegels can often make the issue worse. So, if you're not sure what a Kegel is simply a contraction of that pelvic floor. A lot of times you will be told, just do Kegels. So, it's a contraction of the pelvic floor, hold it for 10 seconds, and then relax. Do that 10 times, 10 with 10-second holds. A Kegel is not going to functionally help you. And oftentimes, Kegels will make things worse because what I typically find is that women are overly tight in their pelvic floor. So it's not an issue of just tightening further with a Kegel, it's learning how to coordinate those muscles, how to both relax and then contract the pelvic floor muscles, and doing so with the right level of an intensity for the task that you're doing. All right. So, urinary symptoms. What's normal and what's not? Let's break down some of the most common reasons women seek pelvic floor PT, which is urinary symptoms. So here's what's normal, because I'll be honest, I did not even know what was normal until I dove into continuing education for doctors of physical therapy specific to the pelvic floor. Because again, in my traditional doctorate program, we didn't get education on this, okay? It was one 60-minute lecture that really just covered the anatomy, and that was it. So, what is normal when it comes to the pelvic floor and urination? So, peeing about 6 to 8 times in 24 hours is normal. So, that would be about every 2 to 3 waking hours. So, every 2 to 3 waking hours, it is normal to need to use the restroom. Waking up once or none during the night to pee. So, if you are getting up twice or more through the night to pee, that is not normal. All right. What else is normal? So, normal is feeling a calm, subtle urge to pee or have a bowel movement. not a sudden, I need to drop everything and run to the restroom type of urgency. A stream that lasts roughly 8 to 12 seconds is also normal. And then no leakage with coughing, laughing, sneezing, jumping, running, lifting, etc. No leakage with those activities is normal. All right. So to learn your starting point, I encourage you to take a urination log. This is something I have most of my clients do after that first visit if they're having any type of urinary symptoms that they're coming in for, because it gives us a look at what your habits are, what your patterns are throughout the day. Now, something we'll find often is, let's say in the morning you have your cup of coffee. I have mine with me today. And you find yourself urinating every 1 to 2 hours surrounding the time that you intook your coffee, versus later in the day, you were able to space out to maybe 3+ hours. And that is pretty common because caffeine is a diuretic and can stimulate the bladder where we feel like we need to go more frequently. It can give us that urge sensation versus when we don't have that in our system. So we can start to learn patterns and how your body responds to what you're putting into it. Now, I personally love still having my daily coffee, but I do know that after I have my coffee, I might have to go to the restroom more frequently within that hour after consuming my coffee versus later in the day when I don't have it. And so there's just a lot of habit formation that we can talk about when it comes to that so that you're setting yourself up for success and not experiencing leakage or having accidents because of certain things that you enjoy having, such as coffee. All right. So here is what is not normal when it comes to the pelvic floor and urination symptoms. Here's what is not normal, even if it's common. So peeing just in case every hour or less. So this would be like when you are leaving the house, and every time you leave the house, you say, let me go to the restroom just in case. Spoiler alert, don't tell your children to use the restroom just in case every time you leave the house, especially if they've just gone to the restroom within the last hour. Of course, if they're in those early potty training days, yes, I get it. But as they're developing their own urination pattern, we don't want them to get used to these just in case pees. This is something that I did growing up and did consistently for a very long time. And it trains your body that you need to use the restroom every time you're leaving. What can also happen then is every time you arrive home, your body associates arriving home with needing to use the restroom immediately. And you get this really intense urge to pee. You rush to the restroom. And when you get there, you just barely have to go. You might leak on your way there. And you're like, why did I just pee my pants a little bit? And I only had to pee for like 3 seconds when a typical stream should be 8 to 12 seconds. Well, it's because the nervous system has been rewired to think that every time you leave home or every time you arrive home, you need to use the restroom, even though you don't. So it's this brain to bladder connection where the nerve is sending this signal that you have to go really bad, when in fact the bladder is actually not full and you actually don't need to use the restroom. So that is not normal. So again, like that rushing to the restroom with this intense urgency and you can't control it, not normal. Leaking when you cough, sneeze, jump, or run, not normal. Okay. Even just a little amount, very common, not normal. Peeing more than once a night regularly. So again, you're getting up 2, 3 times a night to pee, not normal. Feeling like you never fully empty your bladder. So if you feel like you're going to the restroom, then you feel like you have to like push it out. It doesn't just relax out, but in order to empty your bladder, you feel like you have to kind of bear down or push to get the rest of your urine out. That's not normal. Okay. We need to teach those pelvic floor muscles how to relax, where it should be a very ease filled, relaxing encounter anytime we are on the toilet. So, if you are modifying your daily life around your bathroom habits, like mapping out where bathrooms are, skipping workouts for fear of leakage, or limiting your fluid intake throughout the day, that is a red flag that your bladder and pelvic floor coordination needs support. And that is exactly what we are trained to do with this subspecialty in pelvic floor physical therapy. So we really dove into leakage of urine, but this is also true for stool. So whether it's just a few drops or a full bladder loss, or if it's just a little bit of bowel movement or some stool in your underwear and you can't quite make it there, both of those are signs of pelvic floor dysfunction. Now, this can certainly happen postpartum. And I will say within, those first 2-ish weeks postpartum, if you're experiencing some of this, I would say that is normal. Like that is something where those muscles just went through some trauma, for a lack of better word, and you are going to experience some differences there. But that should start to heal, okay? By 4 weeks, if you're still noticing those issues, schedule a pelvic floor appointment. And my favorite is that we proactively see you so that we can just start supporting you at that 2-week mark and we don't wait to see if it rights itself, because there's going to be no harm in proactively supporting your healing. All right. So, certainly can occur postpartum, but we don't want it to continue. And then in menopause, this is something that I see a ton of because every decade past the age of 30, we lose muscle mass. So, our body actually starts to lose muscle. And so we talk about strength training and how important it is for women in perimenopause and menopause, because we think of our knees, our hips, our shoulders, like our larger joints, but this is also true for the pelvic floor. And it's just not talked about as much. I have so many women who come to me saying they maybe experienced leakage here or there in the past, but now it's all the time. Or same thing with bowel movements or prolapse and that heaviness and pressure feeling in the pelvic floor. And it's simply because as you age, you start to lose muscle mass, and those pelvic floor muscles are muscles. So if it's an area of your body you haven't had to think of in the past, but you start to notice symptoms in later in life, this would certainly be a time to investigate with pelvic floor PT as well. We also start to lose lubrication to those muscles and those joints, and that makes those muscles less reactive, which can also lead to more issues as we age and enter perimenopause and menopause. But I want you to know it's never something you have to just live with. It is something that we can address no matter where you are on that continuum. Let's dive into pain with intimacy or pain with sex. So, pain during or after intercourse is not normal. It may signal tight, tender pelvic floor muscles, scar tissue, or hormonal dryness. Now, a pelvic floor PT can help address all of these without shame and without awkwardness. Because to be fair, intercourse leads to new life. Like it is biologically something that God created and is absolutely normal. When you have a spouse, when you are married and you want to start a family, this is how we do that. And it should be an enjoyable experience. And it is something that's just not talked about. And I have been so humbled. I'm going to like tear up with this, but I have been so humbled with the amount of women that have come to me who have pain with intercourse, and it's something they're ashamed of. It's something they just grin and bear because they want to make their husband happy, but they themselves are kind of dying inside every time that happens because they're not enjoying it. And I just want to create a safe space for you to know that pelvic floor PTs are trained to help you with this. And it is not something that is awkward. There is no shame involved. Oftentimes, it's simply because you have tight pelvic floor muscles. And tight pelvic floor muscles, that same root cause can lead to a variety of symptoms. So, for me personally, I struggle with tight pelvic floor muscles. The symptom that I struggle with is leakage. And so I know that if I'm not addressing my tightness, I will leak when I run, or I'll get that significant urgency whenever I get home, even though I don't actually have to use the restroom that bad in accordance with my bladder, but my nervous system is telling me that I need to. So that is what I struggle with when it comes to tightness. Others may have zero issues with leakage, but they may struggle with pain. And that pain may be in the hip, back, right? It might be more orthopedic, or it could be pain with intimacy. And so I just want you to know that that is okay, and it is very beneficial to seek help for this because it is something that should be part of you and your spouse's life, when you are a married couple, and to be able to enjoy that process of creating new life and being open to that if that is a goal of yours. All right, bowel issues. So, chronic constipation, difficulty passing stool, and bowel urgency are all things that a pelvic floor PT will dive into to help you with. The pelvic floor plays a huge role in coordinating our bowel movements. And often it's more than just needing more fiber or hydrating more. It's actually how well your muscles are functioning. And this brings up a really good point on hydration. Sometimes women with issues of loose bowels or with urinary leakage will reduce their water intake because they think that'll help them not have to use the restroom as frequently. And this can actually make us backpedal for a few reasons. One is that it's going to increase the pH concentration of your urine. So if you think of when you're dehydrated or you haven't drank enough water and you get kind of foul smelling urine, it's really yellow, it might be cloudy. That is what is sitting in your bladder. And so it is not a good idea to reduce your hydration intake. Same thing if you're having loose stools. We need to get to more of the root cause of your gut. Is your gut not absorbing the nutrients you're putting in? Is your gut not absorbing your hydration? And oftentimes the issue is that it is not, right? And so with a lot of clients, I'm recommending element or any form of electrolyte that has a good amount of magnesium, potassium, sodium that is going to help your body absorb the hydration you're putting in. So if you have loose stools, definitely consider electrolytes because it can help your body actually absorb the hydration and leading to a more soft but formed type of stool. There are certainly other issues that can be at play here, but that is one quick and easy addition to your routine would be electrolytes. And again, I use Element. I'll drop a code in the show notes that will give you a free 12-pack sample with purchase. So you get free samples, 12 of them, of all of their flavors. I really like their electrolytes. I'll also do some DIY versions at home. So a lot of great options that are really easy to add into your routine when it comes to electrolytes. But bowel issues, please know chronic constipation, we can help. We do different forms of abdominal massage, breath work, all of that to help you regulate those bowel movements. Now, tailbone pain. So, tailbone pain, the tailbone is that very far portion of your spine. So, our spine comes into our pelvis, into our sacrum, that back middle portion of our pelvis. And then at the very bottom is your tailbone. And in some women, it curls under, it kind of hooks under. Now, sometimes that happens after childbirth because the woman gave birth on her back and that tailbone kind of got jammed between the bed and her baby as she was delivering, or as it springs back in post delivery, it's again pushed up by that bed if they're laying on their back and can get pushed in a more curved position or in a malaligned position. Women can experience tailbone pain when sitting after a fall, if you kind of land on your bum or sit hard down on something that you didn't realize was on your chair and sticking out at you. This can all lead to tension in the muscles surrounding the tailbone. So we can either have a misalignment of the tailbone itself or really hyperactive muscles, such as your glute muscles, your back portion of your pelvic floor muscles, and your deep hip rotation muscles that all connect around that tailbone. That can lead to pain there. And maybe you're having pain when sitting, or maybe you're having pain with certain activities. No matter what it is, tailbone pain is not normal, right? It is not something that you need to live with. And this is something that my team and I help assess and then treat to fully address it and normalize your tension and alignment for that tailbone. Now, finally, the kind of favorite hidden connection of the pelvic floor would be orthopedic issues. And this is actually how I got into pelvic floor PT in the first place because I was working at a traditional orthopedic and sports medicine clinic. It was with Ohio State. I saw D1 athletes, I saw regular men and women, such as you and I, who were staying active. And all of our PTs were orthopedic or sports med board certified specialists. I was board certified, still am, board certified in orthopedic clinical specialties. And I saw a ton of hip, back, and SI joint pain patients. And some of those patients would get better and get on their way, but a lot of times those pain points can be recurrent and they would come back in, a few months later with potentially the same issue. Or there were some of those patients that just were mostly better, but not 100%, not all the way there. And it just made me scratch my head and think, is there something that we are missing? And what I came to the conclusion of is that many chronic orthopedic issues of the hip, back, or SI joint have a pelvic floor component. So if your hips always feel tight and you feel like you need to stretch them, so it might not even be pain, but it might just be that chronic feeling of tension or tightness that you need to stretch. Or if your back aches with certain positions, or if your sacroiliac joint, your SI joint, which is right in the back of that spine where that sacrum meets the side portion of your pelvis, if your SI joint flares with standing, walking, or pregnancy, you likely have an underlying pelvic floor imbalance or core coordination issues. And again, the pelvic floor and that deep core are very integral layers that we are trained as pelvic floor PTs to look at. So you don't need to wait until you've tried everything else to consider the pelvic floor as a component of your orthopedic issues. That's why in-house in my private practice, we focus on both orthopedic and pelvic floor physical therapy to really wrap it all into one holistic approach because it all functions together and really shouldn't be looked at in silos. So, when should you actually seek a pelvic floor PT? Definitely if you're pregnant and want to prevent issues proactively. I love seeing patients in that first trimester of pregnancy to really lay the groundwork. And then if things are going good, we just need some education there. Then we'll meet again in your second trimester, same thing. And then that third trimester more frequently to really prepare the pelvis and the body for birth. And then if you've had a baby, whether 3 weeks ago or 13 years ago, you should definitely see a pelvic floor PT. In Europe, it is standard of care that every single woman is given a referral to physical therapy, to pelvic floor PT prenatally, so during pregnancy, and then postpartum. This is something that I want to just scream from the rooftops because it can prevent so many issues in the healing process if we can proactively support women through these life stages. So, whether you've had a baby 3 weeks ago or 13 years ago, reach out. Pelvic floor PT is for you. And then, of course, if you're dealing with leakage, urinary urgency, or pelvic pain, whether with intercourse or just daily life, then that would be a time to seek out a pelvic floor PT. And then pelvic surgery, endometriosis, trauma, a C-section. Those, of course, would also be times where a pelvic floor PT can help. And then finally, if you are feeling just disconnected from your core or your pelvic region, maybe it's an area of your body you've just felt shame around or like you can't talk about, and you want to understand your body more deeply, even if you feel symptom free, reach out. Okay. That is also how we can help you. So, in short, your pelvic floor is impacting your quality of life across the board, and it can be this missing link, whether we realize it or not. And a trained PT in pelvic health can be your go to if you're dealing with any of these symptoms or want to proactively support your body. Now, at Holistically Well, we combine an evidence based physical therapy approach with root cause functional medicine care. We look at your breath, your nervous system, your posture, your movement patterns, your stress levels, and how they all impact your pelvic health. Because we believe your pelvic floor is part of your whole story and not just a body part to fix. Now, if any of this connected with you, if it resonated with you today, know this: you are not broken and you are not alone. I have treated hundreds of patients for these types of symptoms, probably over 1,000 at this point. You are not alone. So, whether you're peeing a little when you laugh or quietly dealing with painful intimacy, there is support and it can literally change your life. You can book with our team or explore our online resources further at drkaylaborchers.com or send me a DM at Dr. Kayla Borchers with the word P floor. So that would be the letter P and then the word floor. And I will send you some direct links to our pelvic health offerings. I have both in person and virtual self paced, go at your own speed offerings. So I can support you no matter what season of life you're in and no matter what your schedule looks like. If this episode resonated with you, if it helped you today, would you take a second and share it with a friend? Chances are they need to hear this too. Until next time, take care and be well.